Okay, so I think we're ready to go. So, dear all, welcome. I'm Mariangela Pellegrini. I'm the Educational and Patient Program Manager for the ERN-EuroBloodNet, and I'm really happy to welcome all of you on behalf of GenoMed4All and the ERN-EuroBloodNet to this educational program on artificial intelligence in hematology for public at large. Indeed, for presenting you this program, it has been conceived by the GenoMed4All Educational, Scientific and Technical Committee. As you can see, it is an European live interactive program on artificial intelligence and its application in hematology. This program, as said, is really targeting public and large because it aims to increase the awareness of these of the advances of this indeed growing role of artificial intelligence and the application on the diagnosis, treatment, follow-up in all the different area of hematological domains. As you may know, this program consists of a cycle of 4 webinars. Every webinar is indeed a lecture provided by key expert speaker on this field, so on the application of artificial intelligence in hematological diseases. Before starting, I want to share with you some home rules. So as you can already see, this program is registered, recorded, because all those webinars will be videos implementing in GenoMed4All and EuroBloodNet website and e-learning environments. So if you don't feel comfortable with that, you can change your name in the platform, in the Zoom platform. You can switch your camera off, or you can write to me and I will take care that you will not appear in the video. Then the structure of this webinar. So there will be the lecture of 2 speakers that I'm going to introduce together with the topic. And then at the end of the presentations, there will be the Q&A session. As you can see, my colleagues are sharing the slides. This is a tool that allows quick and precise interaction among the question raised and the answer. So if you want to raise your question, please join at the slido.com with this hashtag, or you can screen the QR code. By the way, we will repeat those instructions in the chat, so you will not miss it. So let's arrive to today's lecture. So today we are going to talk about the GenoMed4All and EuroBloodNet for precision medicine in hematology. Today we had a little changing of speakers. So I will introduce to you first Professor Federico Alvarez. He's telecom engineer at the Universidad Politécnica in Madrid. He's working as full professor there in the area of media communication and applied artificial intelligence. Among other European research projects, he's nowadays the coordinator of the European program Horizon 2020 GenoMed4All, so artificial intelligence for genomics and personalized medicine. And with him, this is the changing I was announcing before, instead of Marmanu Pereira, we have Victoria Gutierrez Valles. She's also based at MAR in the Vall d'Hebron Research Institute in Barcelona. She's the scientific manager of the ERN-EuroBloodNet, and she's in charge of the definition of the network and the scientific strategy. She's also involved in the European platform for patient registries or rare hematological disorders like Enroll and RADIP. So please, I will pass the floor to speakers. Thank you very much.
Okay, thank you very much for the nice presentation. So for today, I will give an overview of the activities. As we'll say, that will be different webinars to present, let's say, more in details some of these activities. Second important point is that today we'll offer this webinar, but of course questions can be posed, and we are as well expecting, let's say, more questions to come that can come in on a later stage. So any day that you would like to extend or question or propose things, of course, we are open. So let me start by overview of the activities and as well what we are looking for in the project. I think it's important to as well understand how this is related to the let's say overall ERN, and I believe that some of the parts that we are going to explain and propose would be of your interest. So let me my screen. Can you see the full screen, right? Okay.
Yes,
so
perfectly.
let me start by GenoMed4All is an initiative. It's funded by the European Commission. Started 2021. Will end at the end of next year, 2024, and it's one of the initiatives that we believe would benefit the whole EuroBloodNet community. The focus is on genomics and personalized medicine with application of artificial intelligence methods. And this project is fully dedicated to hematological diseases. We have 3 cases, but we need to understand that the let's say technology or studies or trials that we are carrying out can be extended to all the diseases of the more than 400 different diseases that we can find under this domain. This initiative likes to transform, and in the way that the past there were a lot of work in AI, but especially in let's say diseases with large numbers of cases. What is important is to understand that this to be translated to cases where we have rare diseases, that the numbers are not the same, the resources are not the same, and we need to find a way. So let's say in Europe, although there are much less cases than in the, let's say, large number of diseases, we should be able to do 2 things. The first thing is really to do the pooling of the genomics and omics health data, and this is something that we cannot find in a single repository. So not in a single hospital we can find all that information. So the first idea of the project is how we can let's say connect and be able to share data among different repositories in Europe. So it's important to understand that this pooling of genomic, multi-omics data can be done in a way that we can share and then apply AI models. The AI models should be applied in a way that as well, this is ethical and regulatory compliant. That means that, let's say that we cannot share the data of patients, okay? So the whole way that we're thinking of uploading data to a central server cloud thing is something that we believe is not going to scale up, and it's much more difficult. And we provided as well AI algorithms that can learn without the data to be moved from the hospitals or from the repositories. So in that way, let's say more hospitals would like to participate, and for sure, let's say we keep a better privacy of the patient and as well more security. The models will be provided with high-performance computing, so as well providing the computing resources. And we started with 10 clinical sites, but this is just a start. We don't want to end the project only with 10 clinical sites in Europe on the hematological diseases field, but like is to really have a network of as much as possible clinical sites connected and participating in our initiative, and be able to as well implement the tools, technologies, algorithms, and clinical loans that we are. We are 23 organizations. Okay, the coordinator is a technical university, that is where I am. But we have a good number of different universities, technological companies, and high-performance computing, and we have as well dissemination partners. So let's say that you can recognize there are a good number of EuroBloodNet members, and as well different, let's say, partners that are working in that domain of genomics, as CRG. We have Aldebaran, we have Humanitas, we have FCSP, MLL, UMC, Utrecht. So let's say that different partners are collaborating, and we want to increase that. I will explain later on. So our ambition is that really connect massive numbers of omics and clinical data. And when I talk about massive, it's not incredible large numbers. It's to capture a good number of representative cases in Europe per disease. For instance, so we have the case of sickle cell disease that numbers can be around 30 or 50,000. So capturing 10% of these cases, we can do, let's say, a good or incredible study compared to what it was before. It can be done to many others. We have the MDS, again, that we are connecting, and multiple myeloma. Okay, there are much more cases, but I think that the ability to connect different repositories of data, being able to let's say pool all the information in that cases, improve the quality of that information, will in the future improve, of course, the study of the diseases. So we would like this to, of course, with different kind of AI models that I'm not going to detail today, because there's another webinar, and fuse this information so we can learn from different modalities, okay? So we would like to exploit the multi-omics data, including genomics, metabolomics, and radiomics, that are the images, plus clinical information like longitudinal matter. So all of this will be combined with AI. And okay, having 10 sites is fine, okay? But much better to say that to reach at least, we say at the start of the project were like 86 members in EuroBloodNet, now much more. So we like is to connect in all EU countries this repository, have the ability to connect with genomics, radiomics, clinical data, and improve the accuracy of the markers and prognosis, includes the adoption of open standards for omics data, so will be better. So we will offer tools to really transform data into something that can be an open standard, so much better if we want to compare and among sites. And as well, the time reduction in the analysis. So in many cases, takes a lot for any algorithm to be trained and to learn, and would like to reduce it. And the ways as well to let's say, be able to scale it. So let's say that we like to innovate, of course. We'd like to have interoperability. So let's say that the only way is that we provide the tools. So let's say that the repositories on clinical sites can interoperate. So we are finding cross-border data sharing ways of doing, and compliant methods, such as Phenopacket, SOMOP, and some other models. But okay, I don't want to enter so much. This trust means security and privacy by design. So it's important that we offer this privacy and security, and the scalability. Scalability is, let's say, the way that we can add much more partners, in the way that adding one more partner, the result of the federation will work. The important point that we can see here, as I'm saying, is that we'll take in the left-hand side, as you may see here, the different kind of omics, clinical, and biobank data that can be found in different clinical sites. It's not a problem, it's in all clinical sites, all this information is available. So we count that maybe not all of them have genomic information, but maybe they have proteomics, so it's fine. So what we are going to do is take all this, transfer to something that is it possible, let's say, interoperable to share, and let's say, do these different studies, okay? Of course, we would like to explain how the AI was done to get the results. And then we want is to have and publish with open data and fair principles. This is, let's say, the way that we would like to propose that things work. The difference that maybe it's as well interesting for you is that we are doing a federated learning platform approach. That is a privacy respectful way of learning. I don't want to enter so much technical details, but the idea is that the data, the omics data, any the clinical data, will be in the repositories of the hospital. So never this information will come externally to a central server that we don't know what happens there. What we're going to do is that just apply a distributed models of AI that are able to learn in these different sites and aggregate to a central model that only the parameters. So let's say that we keep the privacy there. So not patient data, private data, data that can be able to trace back and recover the identity of the patients will be transferred. And as well with these models, we can scale up. So participating in the network means that I will keep the data, I will keep the ownership and the control of what happens with my data. Only the algorithm will be sent to you and then the results consolidated globally. That's the data flow in the platform that I'm not going to enter so much. Just if you need more information, is just something is that the part of the data platform that GenoMed4All is developing will be installed in the premises of the data, let's say, clinical partners participating. And in that way, okay, we have different models to curate the information, check the data quality, preprocess all the different genomic, radiomics, and clinical data, standardizing data. So all that processes and ingesting of data, we have tools that will be provided, and we will be able, let's say, to as well organize the information so it's possible to be comparable to other sites. The challenge here, as I'm saying, is that of course, okay, we need to find a way to connect different repositories. Why is relevant that we connect more and more repositories? There are like 450 variants or less, and some of them are oncological, some of them not oncological, but most of them have a genetic background. So let's say that a lot of studies have been done with clinical information, clinical data, but not so much using emerging genetic and clinical, genetic and radiomic information, genetic and metabolomic. So we'd like this, let's say, to do it. And the only way to really have a good amount of data for this so rare diseases is to connect the EU repositories that currently are non-connected. They are in different standards, they are following different models, different languages. So we'd like is to really be able to improve the research. So we are going to offer all this to EuroBloodNet members, okay? So this is something that is in our, let's say, core part. Now going a bit more, let's say, beyond and going to the, let's say, the cases. Cases does not mean that we are just interested in that 3 cases. Of course, we would like to increase the network in that cases, but let's say can be extended to other diseases. So we are going to deploy a kind of white box AI model in 3 real-world pilots that are the MDS, MM, the multiple myeloma, and sickle cell disease. So what we are going to do is, let's say, in these 3 areas, the diagnosis, prognosis, and treatment. For instance, in diagnosis, the algorithm for early identification of high-risk individuals. Prognosis, the prediction, the algorithms are predicting the insights of the development of the disease. And treatment, let's say, decision-making support. So the algorithm are not taking decisions, but are suggesting how to make decisions, for example, in stratification or changing treatment or assessing on on the best, let's say, a point of the time for the treatment. Of course, that's linked with let's see, with the drugs, but let's say that all together we are providing these algorithms. These algorithms as well can be in the future, let's say, tuned for similar things. What we are doing, for example, in MDS, that you know, that is a group of bone marrow failure disorders. Let's say that we are doing with the prevention based on genomic screening, omics-based classification and prognosis that are predictive models with integration of genomics and clinical information. Omics-based clinical decision-making, that is to stratify probability of the response to specific treatments, and the drug repurposing, that is a rationale for drug repurposing on specific subsets. We started by the first three. Last one, okay, is on the way, but let's say on the first three we are starting to have some results that, of course, let's say that are currently develop the publications, and some more information webinars will be given. Multiple myeloma, okay, instead of bone marrow cancer. What we are doing with the AI is to describe the different layers to understand the complexity, identify the evolution, risk progression, that is a prognosis risk score, and radiogenomics, that is to develop a model to predict treatment response with the radiomics and genomics, that is radiogenomics, to really do this validation. The first, let's say, model is coming this month, so it's nice to announce that, because I really think that it's a good outcome. And the last is non-oncological, that's sickle cell disease, that is an hereditary red blood disorder. Let's say that we are identifying mutation, association to inflammation, allocation to understand the sickling risk profile. This is coming from the genomics, annotated genomics files, and a combined model to predict the outcomes. And as well, we are doing this AI-based radiomics about the silicon infarct. As well, this month we expect to have with results from the brain images that we are working, and that's something that in the past few models were trained on this. Other techniques that may be as interesting is that the synthetic data generation, that let's say we're available in the ways that if there's no data in some repositories, we can create synthetic data. So let's say we can balance data. Imagine that in one hospital we have 200 cases, in another we have, let's say, 50 cases. We can recreate with synthetic data to enlarge and then have comparable number of patients. So it's something that we are working on the generators. Working on causal models that are the way that we can explain the results. So let's say the causality and the confound factors with the study, and the fusion of clinical, optical, and radiomics information. So that's, let's say, the first overview that I wanted to give, and just let's say let's say overview of what we are doing, and of course let's say the first approach of GenoMed. Others, let's say, seminars will cover more in detail, and just to support the willingness to increase the network with this and other use cases that are studies diseases that I'd like to take into account. So thank you very much for your time.
Thank you very much, Federico, for the presentation. And now I'm going to share the screen. So thank you very much. Thanks for the overview and also for the kind introduction. And for today, I would like to briefly present you the main overview and background for the implementation of the European Reference Network on Rare Hematological Diseases, EuroBloodNet, and also some of the main actions implemented for the implementation of its central registry and role, and different actions addressing the epidemiological data for hematological diseases and for the reuse of data for its use in research and other collaborative projects. So first of all, because maybe it's a new concept for some of you, I would like to introduce you the rationale for the European Reference Network. What are these networks? So as you know, the rare diseases are defined as those affecting less than 1 in 2,000 individuals. And due to this small number of patients, it's very common that the expertise and the knowledge for the proper provision of healthcare to this kind of patients are scattered across Europe, and it's not easily to find in the different European member states. With this idea of increasing this cooperation and concentration of expertise and resources, the European Commission established in 2017 24 European reference networks, acting as networks connecting healthcare providers with expertise for the appropriate provision of healthcare for these rare disease patients across Europe. One of these 24 ERNs that covered different medical specialties was EuroBloodNet, that tackles the rare hematological disease patients. EuroBloodNet currently covers 450 rare hematological diseases that are divided into 6 different subnetworks or thematic areas. These diseases are divided into oncological hub, including the myeloid and the lymphoid malignancies, and the non-oncological hub, including red blood cell defects, bone marrow failure, rare bleeding and coagulation disorders, and hemochromatosis and other diseases related to iron and M synthesis. At this stage, EuroBloodNet includes 103 healthcare providers in 24 member states that are connected for the concentration of this knowledge and expertise. And it's also important to mention that we include 11 patient representatives that are called also EPACs, that are nominated through EURORDIS as the umbrella for the rare disease patient associations in Europe, and that ensures that the patient's voice is heard and the patient's centered approach is implemented in the network through the different tasks and actions developed in the context of the ERN. So as the main goal of the network is to promote the excellence for the best healthcare in rheumatological diseases at the EU level, basically through the provision of different actions in 5 transversal field of actions that are addressed to 5 specific objectives. On the one hand, we have the cross-border health area, including the actions related to enhance the equal access to highly specialized healthcare and cross-border health for rheumatological diseases in Europe. We have also the best practice area to promote the best practices in prevention, diagnosis, and clinical care across Europe, through the development of new and also the update of clinical practice guidelines and other clinical decision-making tools, as could be, for instance, recommendations for health professionals. On the other hand, we have the continuing medical education to spread the cutting-edge knowledge and facilitate this education for health professionals in the field of rheumatological diseases. Also, we have the telemedicine area, where the European Commission has developed a specific platform for the sharing of complex cases to achieve a proper diagnosis or, for instance, a treatment across ERNs. This platform is called the Clinical Patient Management System and ensures this telemedicine and the sharing of patients' data cross-border. And lastly, the clinical trials and research area strengthen the use and reuse of health data for the provision of promotion of research and innovation in the area of the hematological diseases. Of course, the ERNs and EuroBloodNet in detail counts with a wide number of stakeholders for the different actions, including, for instance, the European Hematology Association as an example for the development of best practices, the education and training. We include collaborations with different projects, for instance, some Marie Curie projects, of course, the development of research as an example of today, GenoMed4All. And specifically, I would like to highlight that we include different collaborations with the other 23 ERNs to ensure that the strategy for the rare diseases are aligned across the 24 networks. And this includes not only at the level of the coordination, together with the European Commission, but also especially for the development of patient registry and, of course, collaborative research projects, which is the specific topic of today. So in this context, which is the European strategy for data gathering and the reuse of data? As Federico has already introduced, there are currently hundreds of repositories across Europe containing rare disease patients' data, but that are not interoperable at all, mainly due to the lack of European standards until very recently for the implementation of rare disease patients registry. So this lack of European standards has led to a wide number of repository of data that are not talking each other and that are not able to pool the patient's data at a European level to gather this kind of evidence required for the conduction of research projects or clinical trials, for instance. So in this context, the European Commission has established the EU Rare Disease Platform, trying to cope with this fragmentation of patients' data. So in this context, they have defined a set of 16 common data elements, common for all the rare diseases, that are aiming to be implemented in all the rare disease registries at the European level. So at least all of us are gathering these 16 elements and gathering this evidence for these aspects at the EU level. On the other hand, the EU Rare Disease Platform has also developed the pseudonymization tool, which allows the sharing of data in a pseudonymized way, and therefore respecting, of course, the General Data Protection Regulation. Additionally, the Commission has also provided some grants for the 24 ERNs for the development of central registries that includes, of course, the standards defined by the EU Rare Disease Platform, and that ensures the building of new registries aligned with these strategies. And also, this is very important as well for all the existing registries, to upgrade them, ensuring the implementation of these standards and ensuring, of course, the linkability and interoperability of the existing data that is already gathered in these existing repositories. So for these common strategies, the 24 ERNs has been working together in the frame of the ERICA project and of the European Joint Programme for Rare Diseases, and especially has devoted many efforts for the development of the domain-specific common data elements, so expanding with some extra elements these 16 rare disease common data elements. and increasing a little bit the evidence for this kind of rare diseases into different areas. And also we have been working together for the development of the legal and ethical frameworks, because of course the GDPR affects to all the 24 ERNs and rare disease registries. Also, Federico has introduced the FAIR principles, which are not the main topic of today, but just to mention that it stands for the increase of findability, accessibility, interoperability, and reusability of the data that is gathered in this kind of registries. On the other hand, EuroBloodNet has developed a research agenda, which of course addresses this kind of epidemiological and data gathering topics in different actions and pillars. So, of course, we ensure the epidemiological surveillance and reuse of data, trying to facilitate this surveillance that is lacking so far in many aspects, and also include the reuse of the standardized clinical data by the linking and making interoperable the different repositories in Europe. On the other hand, and very linked to Pillar 1, we have the second pillar addressing collaborative translational research projects, promoting the implementation of collaborative research projects for personalized medicine by combining different clinical data, and also promoting preclinical studies and, on innovative treatments and therapies. Lastly, we have the Pillar 3 for the promotion of clinical trials, trying to increase the access to clinical trials on very rare diseases and breakthrough drugs, and also to promote the development of academic clinical trials. This pillar is, of course, very linked also to registries, which are the key tool for the identification of patient cohorts, which is very difficult for the rare disease areas, as you know, for the identification of these cohorts leading for the development of new clinical trials. So with this context, we have the creation of the Enroll platform, which is the European Rare Blood Disorders platform, and is the central registry of EuroBloodNet. Enroll acts as an umbrella for new and existing registries covering rare hematological diseases, aiming to avoid this fragmentation of data by promoting these standards of interoperability released by the EU Rare Disease Platform, and of course ensuring the General Data Protection Regulation compliance. So all in all, by allowing this pooling of data, we will reach the critical numbers to conduct clinical trials and promote research projects to, at the end, have the better healthcare provided to the rare hematological disease patients. Enroll is coordinated by the Valdebron University Hospital and the Research Institute, with the coordinator Maria de Marañón Pereira. Also, the consortium includes the APHP with the Hospital Saint Louis in Paris with Pierre Fenot, the Erasmus University Hospital in Brussels with Beatrice Gulbis, and the Cyprus Institute of Neurology and Genetics in Cyprus with Petros Kontouris. Also, it's important to mention that Enroll is endorsed with the European Hematology Association, and also that patient's voice is also integrated in the Enroll Steering Committee with different patient representatives that ensures the proper patient-centered actions in the registry. So this diagram represents how the data is gathered, just as an overview through the Enroll platform. Basically, Enroll gathers data from individual sites, which could be, for instance, any electronic health record in any hospital, and also from existing national registries, if it's the case. ENROL is also promoting the development of new national registries by supporting some actions and providing some technical support for the inclusion of these interoperability standards, for instance. But how the data is transferred to ENROL platform includes the data transfer agreement signature before the transfer of data, of course, which ensures a proper legal frame and ensuring the GDPR data protection regulation. And then also, it's important to highlight that the data is transferred in a pseudonymized way. So the pseudonymization takes place always at the site level, and the data that leads to this direct patient identification is not transferred to the ENROL platform. So once the data transfer agreement is signed and that the pseudonymization has taken place, this data then can be transferred to the ENROL platform. In a second step, some aggregated data is transferred to the European Commission, but just as general numbers for an overview of the epidemiological status for the rare diseases. So as I just said, ENROL gathers information from individual sites and also from national registries. And in this context, I would like to show you how the data can be transferred from an existing registry. So this is the case, for instance, of the collaboration established with RADIP, which is the European platform for the rare anemia disorders. So RADIP compiles the data from individual sites and existing national registries for the rare anemia disorders, and it's transferred to this European platform. Then, through a collaboration established with ENROL, a subset of this pseudonymized patient data is transferred to ENROL. And then how this data can be reused at the level of the research and collaborative projects. So, for instance, with GenoMed4All. Well, through a specific collaboration with the RADIP, some data on sickle cell disease is transferred to GenoMed4All, and for other areas, disease areas covered by this project, as mentioned by Federico, are gathered through a direct collaboration through the ENROL platform. So in this way, sharing of data is ensured for the reuse and increase the collaborative actions on the research area, as could be the exploitation of data for the development of artificial intelligence or other driven solutions. I would like also to show you, just to finish the presentation, the current coverage of healthcare providers dealing with red blood cell disorders and with myeloid malignancies in the context of the EuroBloodNet. So as you see, we have a different coverage for these diseases in Europe, but we would like to transmit the idea that we are trying to expand and to increase the coverage through the data gathering from healthcare providers, not only members of EuroBloodNet, but also outside the network. So trying to increase the number of data providers and, of course, the evidence gathered for the conduction of these research projects. Also try to highlight again the idea that we are trying to increase the linkability of these electronic health records by the promotion of interoperability standards and trying to cope with this fragmentation of data that is still a real challenge today for the pooling of data and for the reuse of this data in the context of the research. So with this, thank you very much. And of course, if you have some questions, we will be very glad to answer. Thank you.
Thank you very much, Federica and Victoria, for this comprehensive and clear presentation. So yes, indeed. So now there is the moment of the question and answering. You have seen how to gather the question with the Slido. So I think now we can slowly see the question received. Of course, if you prefer to unmute yourself and raise your question orally, we also can do that. Just please raise your hand so I know you want to take the floor, and I will allow you to unmute yourself, because now it's not possible. So I will read the first question for the speakers. First one, thank you for the presentation. You both mentioned there's a disconnect between data repository across the Europe. What do you think the root of this issue is?
Thanks for the question. Well, I think that there are different historical reasons, maybe. Let's say that, first of all, I think that people collaborating more within their country, or maybe with the people they know. But maybe there were no kind of European networks operating in a, let's say, a more connected manner. As well, it's true that, let's say, from having some cases and really have standardized data with all the information there takes time, and you need funding. So I think that the increase as well of the funding for rare diseases increase in that domain. As well, I think that the restrictions in privacy, that is understandable, and security and some other things prevented this, okay, to have a better connection. So I think it's time really to let's say find technology solutions, standards, and procedures to really be able to connect them. So it's something that we can do. Plus, I think that the collaboration between physicians on that side, on the clinical researchers, that knowing what others are doing, and I think this is very important, and that's why I think ERNs and these initiatives should be useful as well to connect people, repositories, and as well people.
Thank you.
Yeah, exactly.
I don't know if yes, you want to add something. Yes, please go ahead. Sorry.
Yeah, yes, totally agree with Federico. I think that now we are in an optimum moment to develop and implement this kind of codifications and other standards for interoperability that has been recently developed. Because so far, some of the repositories and the registries, most of them have been implemented, let's say, in a manual way, in a classical way. So the data gathering has been done maybe through paper and through Excel or other kind of tools that has put some challenges now in the moment of the sharing of this data. And of course, thanks to these new tools that can be developed, will facilitate enormously these kind of efforts for the alignment of the existing data records and other registries and data sources. So, thanks.
Thank you. So I see other question pop up. I go to the second one. Is the SPIDER pseudonymization tool usable even by local application, for instance, public repository, or it is usable only through the European platform?
Yeah, the idea is that the SPIDER tool can be implemented at the local level, and can be used, of course, by its data provider. So, of course, different levels of collaboration can be implemented for the use of the SPIDER. And now the European Commission is providing different ways of use and promoting this implementation of the pseudonymization tool. That is currently being implemented at the different levels. So in this context, I would like also to mention that there are some trainings at the EU Rare Disease platform, that where you can register. So they develop multiple trainings, webinar sessions to ensure that the spider is implemented in the most appropriate way. And also we act also as a bridge. So in case that you may have some question, we can and maybe address it to the Commission, as we are in contact with them for the appropriate implementation of this tool. So thanks.
Thank you. Okay, so I go to the next question from Stefano. Thank you a lot. What do you think about the timing for a first bulk of gathered data from the different sites? Will them be available to the general public?
Okay, about a very interesting thing. Let's say that the gathering of data will be available, let's say, this year, but let's say it's incremental. So let's say we started, for example, in the MDS with 2,000 patients, and now we're growing to more and more. So let's say that will be more and more data available in the next month. But let's say that this is something that is already there. If this is going to be available to the general public as let's say public data, I don't think so. Basically because of the, let's say, privacy and let's say security reasons. What will be available is for those researchers that would like to contribute. That's a different thing, providing that the legal constraints are done. Okay, then combining with the different stories about the synthetic data. Synthetic data will be public, okay? But let's say that synthetic data, I think, will come on a later stage, not in this project, but in a sister project called Synthema. And there, synthetic data can be made public. But let's say that the data that we are gathering from different sites will be available for research of the, let's say, of clinical researchers or any researcher participating under certain conditions that are under some legal terms on how to use the data because of, let's say, GDPR or some other constraints. But of course, this is something that will be offered.
Thank you. So I move to the other question. Thank you for the great presentations. Do you already have a sustainability plan vision for the future after the founding ends of GenoMed4All?
Okay, just very briefly, that's exactly what we want to do with EuroBloodNet. Okay, what I would like is to the sustainability plan will be to offer the technology developed, the methods, and way of sharing the tools to the EuroBloodNet community. So let's say it can be sustainable because of the use, because of let's say, of the possibilities to enlarge the data, and as well, let's say that would like to offer the tools as well for the private sector. So that's the two ways. And balancing both, let's say, we can grow with more algorithms, more diseases, and better created tools, a better network. So we believe that making it for EuroBloodNet and having more members will as well attract the interest, let's say, of pharma or the companies of that can do a study, so we can, let's say, have a sustainable future. First, for the data platform and tools, because it's the way that we can update and keep the maintenance cost. And second, to enlarge, let's say, that having more and more patients, better quality of data, so then to advance the research. But let's say EuroBloodNet is let's say, the core partnership that we would like to do, and the members, of course, to be able to use them for the research.
Thank you. I move to the next question. post-pseudonymization, will data be extractable on a national level, or will higher resolution, for instance, province, city level, also be available?
Yes, so for this kind of specific data requests, there is a legal framework in place already for the definition of this of the data that can be requested and released by Enroll. So in this case, there is a data access model where the data requester can specifically inform on the data that is needed and that would like to obtain from the registry, that will be later analyzed by the data access committee of the Enroll registry, and that is ensuring that the data that is requested is aligned with the Enroll registry and is the minimum data elements that can be requested for the objective that the requester is aiming to achieve. So after this analysis, either the data request can be approved or let's say can be amended in case that maybe some element can be removed from the data extraction, or if other safeguard for ensuring the minimal data release is can be achieved. So after this, also a data sharing agreement is signed with the data requester. So the general data protection is ensured again, and the patient rights is also ensured through this kind of safeguard, where the data requester ensures that the data will not be reshared again, etc. So through this specific flowchart, let's say, or pathway for the data access, also other details can be requested, as for instance, this kind of resolution in case of need, as the city level, for instance. So this, of course, can be, well, needs to be assessed case per case.
Thank you very much. I go to the next question. What are other funded EU IHI projects apart from Syntema you are collaborating with? PS, I'm involved in the Harmony Alliance.
Okay, thank you very much, Helen. We are, I say, collaborating with Harmony Plus. It's very important, this Harmony Foundation that is going to be built. That would like to discuss this at the end of this month in Salamanca. That would like to see how we can as well, let's say, try to find common factors and common opportunities. And as well, there's a project called Impact AML, about AML, that I think started recently. And I think that in this project as well, there are some of the parts that are relevant for what we are discussing. Let's say that at least with these projects, I would like to collaborate, and of course, new projects that will be funded. So let's say we would like to build some kind of network of projects around the EuroBloodNet constituency and hematology that can bring in. So at least these projects you have Impact AML is coordinated by Professor Martinelli.
Thank you very much. So before moving, I see congratulations in the chat. Thank you very much. So I share this. So I really want to share my thanking to the Australia team for the support of this webinar, the GenoMed4All steering committee for organizing, my colleague of EuroBloodNet, and of course to the speakers for sharing their time and expertise with us today. And they make us learn a lot about the application and the work of GenoMed4All for hematology. So thank you very much, and also to the audience for these great debates and many questions they have addressed. Thank you.